All right, I'm doing the valgus stress test. So I'm applying a lateral to medial force above the elbow and a medial to lateral force below the elbow. So I'll do this, and then I'll move throughout the range of motion. Try again, looking for symptoms at the medial epicondyle or compression at the lateral epicondyle. Now I'm doing the Varus stress test. For this one, I'm applying a medial to lateral force above the elbow and a lateral to medial force at the wrist. So I'll do this throughout the range of motion as well, looking for reproduction of symptoms at the lateral epicondyle or compression at the medial. This is the rotary stability test. I'm going to start the patient in extension, apply an axial load at the elbow, flex the elbow, supinate with a valgus load. So it'll look like this. And I'm looking for apprehension from the patient or posterior instability. This is the upper limb tension test 1 for median nerve. I'm going to stabilize the scapula by depressing it and then move from elbow flexion to elbow extension, wrist extension, and finger extension, looking for reproduction of symptoms along the median nerve. And I could also have the patient laterally side bend to the opposite side for greater symptoms. This is the upper limb tension test 2, also for median nerve. I'm going to depress the scapula and then move into extension and supination of the forearm, and then wrist and finger extension. Upper limb tension test 3 for radial nerve. So I'm going to depress the scapula, extend the elbow, flex the wrist and the fingers, as well as ulnarly deviate. So look like this. And then I'm looking for reproduction of symptoms along the radial nerve. This is upper limb tension test 4 for the ulnar nerve. So I'm going to start by depressing the scapula and then start in full extension of the elbow, wrist, and fingers, and then move up into elbow flexion, forearm pronation, and radial deviation, looking for reproduction of symptoms along the ulnar nerve. And for any of the upper limb tension tests, you can have the patient laterally bend to the opposite side to try and cause more tension. Okay, so this is Cosen's test for lateral epicondylitis. For ECRB, you have the elbow in slight flexion. For ECRL, you would have the elbow in full extension. And for this, you're going to have the patient resist the clinician pushing into flexion, ulnar deviation, looking for reproduction of signs at the lateral epicondyle. So go ahead and resist, hold, hold, hold. Good. Mills test for lateral epicondylitis. So I'm going to move the patient into elbow extension, wrist flexion, ulnar deviation with full pronation, looking for symptoms at the lateral epicondyle. Finger resistance test for extensor digitorum at the lateral epicondyle. So I'm going to have the patient lift their third finger up, apply resistance, and then look for reproduction of symptoms at the extensor digitorum on the lateral epicondyle. This is the medial epicondylitis test. I'm palpating at the medial epicondyle, and then I'm going to bring the patient into full elbow, wrist, and finger extension with supination and radial deviation, looking for reproduction of symptoms along the medial epicondyle. The elbow flexion test. So Brett, can I have you bring your arms like this? So I'm looking for full elbow flexion and wrist extension. I would have the patient hold this for 3 minutes, and then if after 3 minutes they had numbness and tingling along the ulnar nerve distribution, it would be a positive test. Snell's test. I'm going to be tapping just proximal to the cubital tunnel, and I'm looking for numbness and tingling produced by the ulnar nerve, which would be a positive test. So this is Wartenberg's test. I'm going to have the patient start in full abduction of the fingers and then bring them together in adduction. A positive test would be if they were unable to adduct the 5th digit. This is the test for pronator teres syndrome. So I'm going to have the patient go into pronation while I resist, as well as extend the elbow. So go ahead. What I'm looking for here is median nerve symptoms produced by it being pinched between the pronator teres. This is the pinch grip test for anterior interosseous syndrome. So I'm going to have the patient bring their thumb and index finger tip to tip. If the patient were unable to do this and went pad to pad, it would indicate weakness of the FDP and the FPL.